Next, we'll be looking at polycystic ovarian syndrome, commonly called PCOS. Now, this is one of the most common hormonal disorders in women of reproductive age, and it occurs when the ovaries produce an abnormal amount of male hormones. Now, at the early part of my slide, I mentioned what hormone the ovaries are supposed to produce for there to be that cycle. So here in this case, rather than producing that hormone, it's producing an abnormally large amount of male hormones, androgens, which is not supposed to be so. And when this happens, some of the symptoms you can have would include irregular periods. This is not far-fetched, considering when we look at the cycle, each hormone plays a part in each phase. And when those hormones are not being produced, it's not impossible for you to have irregular periods. You can also have excessive hair growth, also called hirsutism. You see a lot of women with we call them male pattern hair distribution. So you see a lot of women having hair on their chest, or having beards, or having mustache, or having hair on their feet. That's what we call hirsutism. You can also have things like recurrent acne, and you can also have infertility as a result of PCOS. Now, for PCOS, the exact cause is not known. However, some factors still on hormonal imbalance. We're going to see the role of hormones in most of these reproductive health problems. Insulin resistance, it's genetic predisposition. Now, there's some studies that suggest that PCOS, there's some level of genetic predisposition to PCOS. So all of these have actually been implicated in developing PCOS. For PCOS, the treatment options include lifestyle changes, hormonal contraceptives, medications to regulate your insulin. Like I said, insulin resistance is one of the factors that has been associated with PCOS. And then you can also get on fertility treatments depending on the symptom that you present with from the PCOS. Next, we'll be looking at endometriosis. Now, this is also another common health problem for females. And what happens here is the lining of the uterus, the cells that are present there begin to grow outside of the uterus. So you can find them in the ovaries, in the fallopian tubes, or even other areas in the pelvic cavity. Now, this is not supposed to be so. The exact cause is not known. However, factors such as retrograde menstruation, now this happens when, for some reason, the cervix is not patent enough to allow blood to flow out, so it flows back in. And over time, because of the deposition of those cells in other parts of the reproductive system, you can develop endometriosis. There's also the issue of genetic predisposition. For endometriosis, some studies have suggested the excessive use of alcohol and caffeine also causes a very sharp rise in the production of estrogen, which can also cause you to develop these cells outside of the uterine cavity. Now, symptoms of endometriosis usually include very severe abdominal pain, heavy menstrual periods, painful sexual intercourse, and infertility. Now, treatment for endometriosis would include pain management when you experience pain, hormonal therapy, and in some cases, you need to go in surgically to remove the endometrial tissue lying outside of the uterine cavity. Another common health problem that we'll be looking at is uterine fibroids and ovarian cysts. Uterine fibroids, also called myomas. Now, these are usually non-cancerous growths that you find within the uterus, and largely they're usually non-symptomatic and non-problematic. However, in some cases, they can cause very heavy periods, very painful menses, and they can also cause infertility, because when they grow so large, they occupy so much space in the uterus, leaving very little for the embryo to implant on. So they become an issue. Then for ovarian cysts, these are just fluid-filled sacs. The fluid can either be blood or serosanguinous fluids that form in the ovaries. Now, most cysts are also harmless. Most times they go on their own. However, in some cases, they become very large and problematic, and they can also come with pain. And usually, there needs to be some sort of intervention to drain the fluid. Hormonal imbalance, again, obesity, family history have all been implicated in the onset of fibroids. While for ovarian cysts, they usually can develop during your menstrual cycle, or because of endometrial tissue lying in the ovaries. Remember, for endometriosis, you can have endometrial tissue outside of the uterine cavity, the fallopian tubes, the ovaries, whatnot. Now, considering that they're usually harmless, treatment is usually conservative, so you don't do anything until they become a problem. And when they become a problem, the usual route is surgical intervention, where you go in and you take out the fibroids or you drain the ovarian cysts. Next, we'll be looking at pelvic inflammatory disease. Now, this is unlike other common health problems that are largely structural. This is as a result of an infection. So when someone is exposed to repeated sexual transmitted infections or poorly treated sexually transmitted infections, over time, they can become a problem. They can be massive infection along the reproductive organs, the ovaries, the fallopian tubes, the uterus. And if left untreated for a long period of time, it can cause tissue scarring. PID is actually one of the commonest causes of blockage of the fallopian tubes because there's so much scarring, they block the fallopian tubes. And when that happens, it increases your chances of being infertile. And what are some of the sexually transmitted infections that can actually lead to PID, chlamydia, gonorrhea, syphilis, and the likes? Symptoms of PID usually would include very severe lower abdominal pain, there's fever, there's unusual vaginal discharge, then there's pain during sex. Now, treatment options for PID largely include oral antibiotics or parenteral antibiotics, IV, IM, depending on the severity and if there are other complications. It can also affect your urinary system, you're coming down with also UTIs and the likes. Now, talking about this common reproductive system, it's important to now discuss what we can do personally to maintain a healthy reproductive system. And I'll start with the first one. The first thing is to identify inheritable or familial disease conditions. Now, I had mentioned in some of the disease conditions that there's a genetic predisposition, they're familial, they're inheritable. Understanding the disease condition that is peculiar to your family line also gives you a sense of awareness. So you know what to start checking for very early. Cervical cancer, breast cancer, and the likes. You're already aware that, oh, this is something that is common in the women of my family. So it gives you that early awareness where you can start checking on time. And usually, like I always say, the most important aspect of managing any disease condition is early awareness. Once you know early enough, you start working towards managing it better and earlier. Second one is regular gynecological checks. You can have your pap smears, your STI screenings, and then the self-breast examination. Now, for your pap smears, for women less than 30 years, it's recommended that you have your pap smear done every 3 years. Now, between 30 to 65, it's recommended that you also have it done every 3 years, but you also need to have an HPV test done. And then once you're over 65, if you've had previous positive results, then you also need to have it done every 3 years. But for people who have, for some reason, had a complete myomectomy, you don't necessarily need to have this done. There's also the importance of your self-breast examination. This is something that we encourage women to do from time to time. Every morning when you wake up, after you've had your shower, or while staring in the mirror, just do yourself a quick breast examination to feel for lumps, a change in shape, a change in texture, or any nipple discharge at all. This is very important as it can point to an underlying disease condition. Another thing is to develop a healthy nutrition and lifestyle habits. Use incorporating balanced diet into your meals, regular exercises, adequate sleep, stress management, and avoiding the use of or the abuse of alcohol or caffeine. It is also very important in maintaining a healthy reproductive system. It's also important to get vaccinated. Now, the vaccines below are recommended for sexually active women or women of reproductive age. HPV vaccine. Now, this is a vaccine that protects you against human papilloma virus. Now, human papilloma virus has been indicated in majority of the cancers that affect women. So it is actually very important that you get vaccinated against this. It reduces the likelihood of you developing any of the cancers. There's also the need for you to get vaccinated against hepatitis B and A, and also to get the MMR vaccine. Another thing is to ensure proper hygiene and safe sex practice. Now, as women, ensuring proper hygiene, there should be no douching. And when we say douching, this is when you wash the insides of the vagina with soap. Now, this, as much as you may want to stay clean and stay fresh, it is unadvisable that you wash the insides of the vagina with soap. The vagina has its own microbial flora that protect it against other bacteria. Now, when you wash with soap, what you do is you eradicate that flora, which makes it easy for new bacteria to grow and dwell in there. So on the long run, you're not keeping it fresh, you're actually setting yourself up for disaster. Now, safe sex practice, this involves having, well, I won't say not multiple, but having one dedicated sexual partner if there's a need for you to have sex, and then the use of contraceptives if you're not ready to conceive. So it's important that, and if you're going to have multiple sexual partners for any reason, it's important that you have each and every one of them tested. For some reason, if you're in a hurry, you're not able to test them, you need to ensure that there's the use of contraceptives, preferably the barrier one. Another way of maintaining a healthy reproductive system is to have your antenatal bookings and compliance with your antenatal visits for those who are pregnant. Remember, I said it has to do with the reproductive system all the way from reproduction to pregnancy and delivery. And another thing to consider is also family planning. It's very important that you plan. It's very important that you plan. If you're not ready for childbirth, it's very important that you have that discussion with your partner or with yourself, and then you choose a safe contraceptive method. It's very important because it helps you to make informed decisions about your reproduction. Now, what is the role of family planning in managing reproductive health? Contraception or family planning, it offers you the ability to plan and space pregnancies, preventing unwanted pregnancies, and allowing you to manage your reproductive health. So when you use, with the use of contraceptives, you know, oh, I do not want to get pregnant for this period. It would also inform the choice of the contraceptive that you use. And this helps you to plan, it helps you to space, and then it gives you the power to make decisions on your reproductive health. No contraceptive is 100% safe in preventing pregnancies. It's very important to know that. And each should be considered for use depending on your needs and full knowledge of the side effects. Now, some people do not want to have kids in the short term. Some people do not want to have kids in the long term. Some people do not want to have kids at all. Depending on what your needs are, you need to consider that when choosing a contraceptive. It's very important. And you also need to be aware of the full side effects. You see a lot of people in the hospital, they get on family planning, they're all happy because the only part they considered is, oh, I won't get pregnant. But when the side effects start to come in, they start to wonder, oh, nobody told me this. So it's also very important that you know of these side effects when you're picking a contraceptive for use. And what are some of the options that you have? There's the hormonal contraceptives, you have your birth controls, you have the patches, you have injections, you have barrier methods. The commonest one, condoms for men, diaphragms for women. You have the implants, Implanol and Jadel, depending on the duration you want to stay for. There's the one that gives you a coverage for 2 years, and there's that gives you coverage for 5 years. There's also the IUDs. These are a bit more long term. And I mean, this can also be very uncomfortable for some of the people that take it. And then there's the last one, which is the permanent contraceptive method. Now, for some reason, you don't ever want to have children, or you have completed your family size. Now, you just want to engage in sexual activity without the fear of conception. So you can actually go for the permanent contraceptive method. However, like the name implies, it is permanent. They're usually almost never reversible. So like I said, depending on what your need is, you need to consider which of these contraceptive methods you'll be going for. Now, this is just a picture that shows some of these contraceptives. Now, we'll be looking at some common myths and misconceptions about the reproductive health as a whole, and then we'll be looking at what the myths are and what the facts is. Now, one myth is menstruation should always be painful. Now, the fact is, while you can experience some discomfort during menstruation, severe pain is actually not normal, and it may indicate an underlying condition, endometriosis, fibroid. So when you're having severe pain anytime you have your menses, it should trigger you that something may be wrong and you should seek advice from a doctor. Menses is not meant to be painful. Like I said, some discomfort, slight discomfort, but when you're experiencing severe pain, that's an indicator that something may be wrong and you need to have a secondary review. You can't get pregnant during your period. Now, this is something that's very common in the younger generation. Say, oh, I'm menstruating, so it's not possible for me to get pregnant. Let's attempt it. I can assure you that you may just be one of the unlucky ones, because even though it's less likely for you to get pregnant during your period, it's still very possible for you to actually get pregnant during menstruation. It is very important that you know this. So for those who want to engage in such activities, please have this at the back of your mind. Another myth is that PCOS only affects your ability to have children. Now, this is not true. Like I said, outside of infertility, PCOS also affects some other systems in the body, like your insulin regulation, which can cause diabetes, heart disease, and endometriosis. Another myth is if you're on birth control, you can't get pregnant. Like I said, no contraceptive method is 100% safe. It is important that you follow the instructions carefully, but it's also important that you know that no contraceptive is 100% safe. Okay, so that brings me to the end of my presentation. Now we'll take questions and feedback. Thank you very much.
Okay. Thank you very much. Wow, that was mind-blowing. I mean, there's some things that Dr. Shin talked about that I mean, I thought I knew something, one or two about it, but yeah, I mean, we talked about PCOS, irregular periods, excessive symptoms for PCOS. I mean, irregular periods, excessive hair growth, acne, infertility. And I'm like, okay. And then while talking about the reproductive health challenges, he mentioned infertility, PCOS, menstrual disorders, also made a few points on painful periods, absence of menstruation, heavy menstrual bleeding. Now, one thing that caught me most was when he was talking about the common myth and misconceptions. So, because I mean, I remember back then, way back school days, even as a graduate, where I have some of my friends, and they're like, "Oh, my period is painful, this, that," and I'm like, "Is there something you take for it?" And then I'll be hearing conversations like, it's a regular thing. It will come and go. So now we're getting to understand that why some discomfort are normal, severe pain is not. It may indicate an underlying condition like endometriosis or fibroid. So guys, I mean, we all need to pay a closer attention to our health status. I mean, this is a word to all the ladies. I mean, if you're a guy and you're here, you're not left out because you actually need to hear and know this for your sisters, for your wife, for your cousins, female friends. I mean, you definitely have a female gender around you. Then you can't get pregnant during your period. Sister Nkechi, we're here to tell you that you might be one of the lucky few that will get pregnant. So, thank you very much, Dr. Sheung. We'll be taking the questions. So if you have questions under the question and answer session page, you can just drop your questions and we'll do well to attend to all of them. So I have a question here. Someone is asking, says, what safe contraceptive can women use? I want to tell myself that I'm sorry to cut you. I want to first of all ask a question. Auntie, hope you're done giving birth. And it's not like it's for the period of enjoying your youthful age that you want to take contraceptive to be sure of what, you know. But let's hear from the doctor. He has the final say. What's safe contraceptive?
Okay, thank you very much for that question. Now, with the issue of contraceptive, like I said, there isn't exactly a particular one that is the safest or protects you the most. When considering contraceptives, the first thing you need to consider is what your needs are. So if you're looking for short-term cover, there's no point going to get an IUCD. If you're looking for a long-term cover, there's no point going taking oral pills or taking injectables. So your needs will determine what contraceptive you need to have. And it's also important to know that all contraceptives have side effects. Some may vary across different individuals. For example, you could be on the implants. For some people, they don't see their period for a year. And for some people, they have heavy menses every month. It varies across different individuals. So, like I would say, when choosing contraceptives, those are the two most important things to consider. One, what is your contraceptive need? Are you doing this for the short term? Or are you doing this for the long term? And what are the side effects related to the option you're picking? Those are two things you need to consider. Once you have all of that information, you can then make a decision. So you choose to go for the contraceptives. When these side effects start to come, they may not come, you may be lucky, but when they start to come, you have an understanding, oh, this is as a result of the contraceptive I'm on. So I hope that answers your question. First, consider what your needs are and have a full understanding of the side effects. Then you can make a decision concerning contraceptives.
So more like what works for Mrs. A will be different from what works for Mrs. B.
Yes.
Okay, cool. So I have another question here. Hello. Is it advisable to have sex during my menstruation? You are the Sister Nkechi we've been looking for. Sister Nkechi is asking, is it advisable to have sex during my menstruation? I think I have the answer. I feel like a doctor already, but I mean, I'm just going to allow you do your thing.
Okay, so first off, I would like to understand the need for you to want to have sex on your period. I think the 5 days is not too long to wait for enjoyment to begin. But for hygienic purposes, we usually would advise that you don't. There are also cultural and religious implications regarding spiritual implications regarding having sex while you're on your period. So those are things to consider. There's also the possibility of developing an infection. Your at that point is not exactly pure blood, it's more of dead tissue and uterine wall cells and all of that. And we had mentioned that retrograde menstruation can actually cause these cells to be deposited outside of the uterine cavity. Now, during the process of your intercourse, depending on the vigor or the intensity, there's some level at which you're pushing back these dead cells from coming out. So you can have them implant in various regions where they shouldn't. So generally, it's advisable that you don't. Like I said, it's a 3-day or a 5-day wait. So I'm sure you can wait till the end.
Thank you very much, Doc. Sister Nkechi, please wait till the end. 3 to 5 days will not kill you. It won't kill us too. We would wait for you. I have another question here. Says, good afternoon. Is there any test I need to take before I get pregnant to know the state of my overall health? Okay. Is there any test I need to take before I get pregnant to know the state of my overall health?
Okay, so we can look at this in across various parameters. One, there's the annual wellness that we usually advise people to go for. It goes through a comprehensive list of investigations that are required. But just to mention a few, one, you need to get tested for any sexually transmitted infection. You need to get tested for HIV. You need to get tested for hepatitis B. Now, the reason why you need to get tested for all of this is because should you be positive, there needs to be some degree of care during your antenatal period and immediately after delivery, so you don't end up transmitting the same to your child. So it's important that you actually are aware of your aware of any sexual transmitted infection. Two, you also need to consider your resource compatibility if you're choosing to get pregnant. Now, resource incompatibility is something that we need to start considering when choosing to get pregnant. Reason being, I would like to make an analogy. If for any reason you as the woman, you're resource negative and your partner is resource positive, there's the possibility that your system can be sensitized against that positive antigen. And largely, babies usually take the blood group of their fathers. So that can affect your newborn or even subsequent pregnancies. It can cause what we call hemolytic disease of the newborn, where your body attacks the blood cells of the baby because they see it as a foreign agent. So when you do this test and then you're aware you're negative, your partner is positive, there are treatments, injections you can take, Rogan, just before delivery and during the antenatal process that protects your baby. So it's also important that you know your blood group and then your resource factor. Another thing to also look at is fertility testing. You also do not want to get into a situation where you're trying to get pregnant and then you're trying so hard month on month, year on year, and nothing is coming out of it. And then you start to feel depressed. It may be something that could have been picked if you had done a testing, treated, and then you would have gotten past it. It's also important that you know that your partner should also be tested for the same thing. You may not be the issue, your partner may be the issue. So that's another thing that you need to get tested for. Now, well, I don't like to say more advanced countries, but those capabilities are not exactly available readily here. You may also want to do genetic testing to rule out genetic conditions that run in your family that you're not aware of. You don't want to give birth to a child and then the child develops congenital disease condition and then rather than your child being a source of joy, it's a source of problem. So off the top of my head, I think these are things that I feel you should get tested for just before you get pregnant or while trying to get pregnant. If anyone comes to head before the end of the presentation, I would also mention it. Thank you.
All right, thank you very much, Dr. Sheon. Wow, questions are coming in. Okay, so let me read this. Thank you for this session. My menstruation occurs in a day or two, which is light. Didn't break out in my early 20s. I started breaking out about a year ago. Sharp pain in the left breast on different occasions, like once in a month or 2 months. Did a scan 9 years ago and nothing was found, but still have that pain. And I will have to maintain position till the pain subsides. What tests are required? Never had sex, and I'm 28.
All right, thank you very much. First of all, I'll start with the ultrasound scan that you did 9 years ago. That's completely outdated. You need to have another one done. That's getting that out of the way. Secondly, you may also want to have a hormonal test done, a hormonal profile, to ensure that all your hormones are at the level that they're supposed to be. In terms of the breast, did she mention breast pain or a lump?
Yeah, sharp pain in the left
Sharp
breast.
pain in the left breast. You may also want to engage in regular breast examination, feel for lumps, look for any nipple discharge. If you identify any of all of this, you probably would need to see a gynecologist for further advice and review. But off the top of my head, I think those are things that you should do. You could do a breast scan since you're still under 40. We'll have a breast scan done. You could also have a hormonal profile done. You can have a repeat ultrasound done. I mean, an ultrasound from 9 years ago. The machines that we have available for ultrasound now are not the same as what they were 9 years ago. So we just may pick up something now. I'm not saying there's anything to be picked. I'm not saying you have an issue, but just to be careful. You can't rely on an ultrasound scan from 9 years ago. And then engage in the self-breast examination, like I mentioned. You may also want to inquire if you have older siblings or parents, if there are any familial genetic concerns that you should be worried about, anything that runs in the family. It would also be nice for you to know. Then you can take all of this information and then see a gynecologist with everything that you have found. So I think off this call, I'm not examining you. I don't have your full history. Those are my recommendations for now.
All right, thank you very much, Doc. So I have another question here. When it comes to family planning, I'm always scared because of the side effects you see women experience. Is it true ULD? I don't know what that means, but is it true ULD may prevent one from having children, especially when you still want to have more children? ULD. I don't know if
So does this person mean? Can you go over the question again?
okay. It says when it comes to family planning, I'm always scared because of the side effects you see women experience. Is it true that ULD, so I don't know what that person meant by the ULD, but is it true that ULD may prevent one from having children, especially when you still want to have more children?
Okay, so I think what this person is talking about is an IUD, intrauterine device. Now, like I said,
Oh yeah, the person just corrected himself. Yeah, so it's IUD, sorry.
yes. So like I said, depending on your need, that's what you should consider when picking a contraceptive. Now, for someone who is looking for a short-term protection, going for an IUD, considering the duration of action, may actually delay your conception, and I would explain it. Now, a lot of the contraceptives are hormonal based. What's the word to use? Let's just say they either potentiate or reduce the effect of these hormones that we mentioned, estrogen, progesterone, along each phase of the menstrual cycle. Now, if let's say you want to get protected for 6 months, maybe you're traveling for 6 months, you don't want to get pregnant or anything, and then you go for an IUD that can confer a 5 to 10 or more period. If after 6 months you take out the IUD, there's still going to be some effect on your hormonal system. So if you're looking to conceive immediately after you take your contraceptive out, you need to consider the short-term one. However, for people who are not looking to get pregnant for 5 years, 10 years, yes, an IUD is advisable. An IUD is advisable. But one thing you need to understand is because of the mechanism of action of contraceptives, where they alter the hormonal action on our system, once they are taken out of the system, it takes a while depending on which, for your hormonal system to be fully regulated before you can then conceive. So yes, it's possible that an IUD can delay your conception, especially if you used it for a short period. But for this person, there's actually nothing to be scared of. Like I said, consider what your needs are. Are you looking for short-term protection? Are you looking for long-term? And understand the side effects that come with each one. It helps you make an informed decision on your contraceptive choice. Thank you.
Okay, thank you very much, Doc. Another question. How about having severe abdominal pain on the right part without being sexually active? And when you are sexually active, okay, without being sexually active, and also having same abdominal pain on the right part when you are now sexually active. Then, after several tests, there is nothing there. What seems to this person is having abdominal pain on the right part prior to now without being sexually active. Right now, the person is now, in the game, but still having same pain. But after several tests, the person has had several tests and they keep saying there's nothing there. Is it in any way speaking to maybe infertility? Is it in any way speaking to maybe there's a test this person must should have done that the person hasn't done? I don't know.
Okay. Thank you very much. Now, this question is a bit vague considering that I do not know what investigations you have done. Then I think it's also important to know that right-sided abdominal pain may not necessarily um, infer that, oh, it's the reproductive system. It could be any other thing. So depending on, it would be nice to know, maybe have a conversation with this person, know what tests this person has done, characterize the kind of pain that you feel. Then it would be able to help me streamline on what your possible condition is. But if I'm speaking now, I'm just going to be making inferences and conjectures, which will not help this person in any way. So if this is something that you experience continuously, I would advise you see a gynecologist. Let's have a thorough workup, and then we'll know how to proceed from there. Thank you.
All right, thank you, Doc. I feel this person is a man because I mean with the name I'm seeing here. So I'm quite excited that our male guys genders are here as well. Can a single lady embark on the use of contraceptive to prevent pregnancy? Uncle, what's your plan? But Uncle would like to know that can a single lady embark on the use of contraceptive to prevent pregnancy?
All right, thank you very much. So contraceptives are not dependent on your relationship status. If you're married, if you're single, you can get on your contraceptives. Like I said, being on contraceptive is just dependent on what your needs are. So maybe you have a partner, and now this is just pure conjecture from one of the possibilities. Maybe you and this person, this is your partner. You don't have multiple partners, and for some reason, is of the I like to dive raw variety. You can choose to go on contraceptives to prevent unwanted pregnancy for yourself. Rather than having multiple abortions every time you pick it, you can choose to have a contraceptive. Now, maybe you're someone who has sexual proclivities that you want to explore. You can also choose to be on a contraceptive just to protect yourself from unwanted pregnancy. It doesn't prevent you from the possibility of infections and every other thing, but it just prevents you from getting unwanted pregnancy. It gives you that power to control your own reproductive health. So it's not a function of whether you're single or married. It just depends on what your needs are for choosing to get the contraceptive. Okay, I hope that answers the question.
Okay, thank you very much, Doc. Another question here. Hi, good evening. I would like to ask concerning the vaccine, sexually active women Okay, concerning the vaccine, can sexually active women take HPV, MMR? Do you have to be sexually active to take them? Plus, are they taken regularly or once in a lifetime? So concerning the vaccine, the HPV, the MMR, which you talked about, right? I even have a question about that. So concerning the vaccine, do you have to be sexually active in order to take them? Plus, are they to be taken regularly or once in a lifetime?
Thank you very much. So for the recommended vaccines, you don't necessarily need to be sexually active to take them. Once you're of reproductive age, once you're at that age where at any point you can engage in sexual activity, it is advisable that you get these vaccines. Now, for the HPV, I think it's a one course, or sorry, not one course, it's not a regular thing. I think you just have 2 or 3 courses for the HPV and then same for the hepatitis B. Now, for MMR, we usually would also advise that you get that also because one, outside of it protecting you, it also confers some degree of protection on your unborn child, on maybe a future pregnancy or anything. So yes, you don't necessarily need to be sexually active. As long as you're reproductive age, you are advised to get the vaccines.
Okay, you don't need to be sexually active. Just get your vaccines. So I was saying I wanted to even ask a question. I've always thought MMR were just as in away from vaccine, they were immunizations for just babies. I never knew that the MMR is also taken for adults, that they have MMR for adults. But I mean, that has been added. Thank you for that. Please, is PCOS curable? I'm having PCOS and it takes me months before I see my period. And when it comes, it's heavy, please.
All right, thank you very much. So because of the pathophysiology of PCOS, right now there isn't exactly a cure. Now, I don't know if there are any research or studies ongoing into finding a permanent cure, but there is no permanent cure that I'm aware of as of now. What we do is more of conservative management. You manage the possible complications or the underlying factors. Once you manage that to an extent, the symptoms usually are bearable. So that I'm aware of, I'm not aware of any definitive treatment for PCOS at this time.
Okay, so I also have someone that is asking same question about PCOS being curable, but with a different take to it. The person is saying it takes me months before I see my period, and when it comes, it's heavy, please. And my abdomen used to become very big sometimes. What am I supposed to do? So when the pain comes, when the period right before she sees her period, when it comes heavy and the abdomen will sometimes become very big. So at that point, is there something she can, I mean, now we're talking conservative management. So what is that? What's your advice that the person can do?
So, like I mentioned when I was speaking on PCOS, and like I just said, for management is usually more of conservative. You manage the symptoms. Now, for the heavy, if it's heavy flow for you, it could be put on antifibrinolytics that help to reduce the volume of flow. Now, you mentioned getting bloated. Now, that may be as a result of a number of reasons, but if you have PCOS, I'll advise that you see a gynecologist, get assessed fully, and then we put on a regimen of conservative treatment. You may need insulin regulators, you may need analgesics, you may need hormonal supplements, depending on which your case is. So that's something I'll advise you do. See a gynecologist, let's have a full workup, and then we'll proceed from there.
Okay, thank you very much, Doc. Wow, questions are still coming in. How do we effectively educate those around us about women's reproductive health without confusing them? How do we effectively educate those around us about women's reproductive health without confusing them?
Okay, so that question seems a bit ambiguous, but one, I think it starts from you equipping yourself with information. Once you have the right information, it helps you to understand the peculiarities of each condition and how to break it down in simple terms. You also need to understand that you may be speaking to people who you have no idea what they go through or what their symptoms are. So you can't be seen to be speaking as someone who understands what they're experiencing. You need to be able to find that fine line where you're able to educate them without antagonizing them or making them feel like their uh, situation isn't peculiar. So I think we'll start with the most important part, which is getting the right information. Once you get the right information, it would help you simplify what each condition is. Now, if there are cases where it's beyond you, you would also speak to a dedicated or a specialist who can also further break it down. I usually advise people to limit how much they go online to read stuff. Not everything posted online is correct. Not everything posted online also relates to your race. You may be reading a study that was published for Caucasians as an African, and then it confuses you the more. So if there are any symptoms that you do not understand, I usually advise that you equip yourself with information. And the way to do that is by speaking to specialists or trained professionals and have this discussion with them. So I think that's my own bit on how you can educate people on this.
Okay, thank you, Doc. Getting the right information. Hello, good day. What is considered regular menstrual period? I see mine between the 23rd to 26th, okay, 23 to 26 days, and 28 days once in a while. Is that irregular? What is considered regular menstrual period? I see mine between 23 to 26 days and 28 days once in a while. Is that irregular?
All right, thank you very much. So, one question to ask is one, are you on any medications that may alter your period from time to time? Now, the standard cycle is 28 days, but like I said, for some people, it may be lesser than that, and for others it may be long. Now, when it's considered regular is when you have the same cycle for an extended period. So you're not having a 23-day cycle this month, you're having a 25 cycle next month. From what you have said, you already have a defined pattern. So in that sense, it is regular for you. It may not be regular for other people, but in your own case, because you already have a defined pattern, it is regular for you. However, you also need to consider if there are any additional symptoms to this peculiar cycle of yours. Is the flow heavy? Does it come with severe abdominal pain? Are there other, is there nipple discharge, anything at all? Are you on any medication? So these are things that you need to consider when defining if you have a regular cycle or not. Thank you.
Thank you very much, Doc. How do we manage endometriosis? How do we manage endometriosis?
Okay, thank you. So for endometriosis, like I said, is managed conservatively for the pain that comes with it. you can manage with analgesics, but in very severe cases, there may need to be surgical removal of the endometrial tissue from where it's meant to be. So either it's managed conservatively for not too severe cases, or you go for surgical removal in much more severe cases.
Okay. Thank you very much, Doc. Going through the questions. Are there signs for infertility? I think this is the last question. Are there signs for infertility? How can a woman know that, okay, once I'm seeing this, once I'm seeing that, it's speaking towards it, I need to jump right at it?
All right, thank you very much, Emmanuel. So now, from the definition alone, that's literally the only thing we need to be concerned about. Once there's regular, unprotected sexual intercourse for the duration of a year with no possible conception or with no possible pregnancy, then you need to start considering the possibility of infertility. There is no specific sign that when you see this, oh, this definitely confirms that you're infertile. No. The thing to look out for is for the period or the duration of a year, you've had regular unprotected sexual intercourse with your partner, yet not at any time did you get pregnant. Then you need to start considering the possibility of infertility. Like I said, it may not be a you thing, may also not be a him thing. They are very idiopathic causes. Everybody's fine. Nobody knows what is wrong. It's only when you make that, because if you go to the hospital, one of the questions would ask you is, oh, how often do you and your partner meet? How regular is it? Do you meet when you're ovulating? I think that's also something that I need to mention. If for any reason during the 1 year that you were meeting your partner, you were meeting him on days when you were not ovulating, that's also a possibility. And I think as a way of, since that's the last question, as a way of, would I say, giving a cheat code on knowing when you are ovulating, even though yes, there are defined tests or things to look out for, but there's a cheat code that we use to tell people who are trying to conceive for how to know when you're ovulating. So I'll give that before the end of my presentation. But like I said, that's the only thing you need to look out for. It's regular, it's unprotected, you're definitely ovulating. Then you may now start considering the possibility of infertility. Now, what's this cheat code? Remember I said the menstrual cycle is a 28-day cycle, and your ovulation is usually on the 14th day when your estrogen is at the peak. So what we tell people is count 14 days from the first day of your menstrual cycle. So let's say not the last day, not middle, the very first day. You count 14 days from that day. Now, I should also say this applies largely to people who have regular cycles. Now, once you've counted 14 days from the first day of your menstrual cycle, pick 2 days before and 2 days after. So let's say the 14th day falls on the 17th. For 15th, 16th, 17th, 18th, and 19th, those are the most likely days that you would be most likely be ovulating, and those are the days where we recommend that you meet your partner. So that's just the cheat code for knowing when you're ovulating. Now, this doesn't work for everyone. If your cycle is not regular, this will not work for you. If you have other background underlying conditions, this also may not work for you. But for those who maybe have gone through all of the tests and everything is certified fine, this is something you may want to consider. Thank you very much.
Okay, thank you very much, Dr. Sheon. Wow, cheat code. See why I said my male gender, you ought to be here. I'm sure a lot of us have been educated about the cheat code. So guess what? Go into the world with your spouse and multiply. because the cheat code has been given by Dr. Shen. So one last question just came in. It says, "Hi, is fetal development considered the cause of body deformation in women?" Fetal development, is that the cause of body deformation in a woman?
So this person may need to explain what he means by body deformation. So when you say body deformation, what exactly are you speaking to? That's something I need to understand. Yes, it's been said that, oh, when women get pregnant, because of the effects of hormones, the breasts get bigger, there's foot swelling, there's weight gain, there's some sort of facial distortion and all of that. So is that what this person is speaking to, or is there a body deformation that he's being peculiar about? Yes, if what I've said is what you're explaining, yes, it's true. Because of the hormonal changes that go on during the various phases of pregnancy, it's not unusual that these symptoms occur. So it's actually very possible if that's the body deformation that you're talking about.
Okay, thank you, Dr. Shen. Now, these bring, I believe we do not have any other question. Check in, check in, check in. Yes. Ladies and gentlemen, this brings us to the end of our health session, particularly for our female genders all over the world. The topic is the female reproductive health. And we went through a journey understanding the female reproductive health by no other person than our very own Dr. Shen, where we got deeper insights of knowing more on infertility, endometriosis, PCOS, how to even use them contraceptive. For the men in the house, we received the cheat code, which is a good thing. And I mean, it's quite important for us to know that here in Avon HMO, we take health matters very seriously, and we do our very best by all means necessary to ensure that you live a healthy and fuller life. So, our advice from us to you today is please know your health status. Please pay close attention to your health, and always ensure to saying no to self-medication, right? Do your very best to always see a doctor before you start taking that medication. That it worked for Mrs. A, so our females in the house, doesn't mean it's going to work for you being Mrs. B. So be sure to see a doctor, get the right medications from the doctor, and be sure to take your medications accordingly. From the team, myself, Dr. Shen, and organizers of this webinar, we want to say a big thank you for staying with us to this time. And from all of us in Avon to the women in the house, happy Mothering Sunday, happy Mother's Day, happy Women's Day, whatever you want to call it, happy women. From all of us in the house, we're saying thank you. Dr. Shen, a lot of people are saying thank you to you. You now have fans. Yeah, he's grateful for your accolades. Thank you very much, ladies and gentlemen. Do have yourself a wonderful rest of day. Bye-bye for now.